ഹായ് എവരി വൺ, നമുക്കിന്ന് 2023 PSC അസിസ്റ്റൻറ്റ് സർജൻ ക്വസ്റ്റ്യൻ പേപ്പർ ഡിസ്കസ് ചെയ്യാം. ഫസ്റ്റ് ക്വസ്റ്റ്യൻ, മോസ്റ്റ് കോമൺ കാർഡിയാക് ഇൻവോൾവ്മെൻറ്റ് ഇൻ SLE ഈസ്. ഓപ്ഷൻസ് ആർ ലിപ്മാൻ-സാക്ക് endocarditis, coronary arteritis, mitral regurgitation and pericarditis. Here, Lippmann-Sack endocarditis is also associated with SLE, but the most common cardiac involvement is pericarditis. So the answer is option D. Next question. 2. Which of the following statement regarding malaria is not correct? In case of Plasmodium falciparum, even after the considerable periods, typical paroxysm may be absent. This option is correct. Next. Sickle cell disease, thalassemia and G6PD deficiency confer some protection against death from falciparum malaria. Correct. Severe hepatic dysfunction mimicking acute viral hepatitis will never occur in malaria. This is false. Hypoglycemia is very common complication of severe malaria. So here the incorrect option is option C. Next question. Euvolemic hyponatremia is seen in all except euvolemic hyponatremia is seen in hypothyroidism, SIADH and glucocorticoid deficiency. It is absent in congestive cardiac failure. So the option is option C. Next question. The following are risk factors for hepatocellular carcinoma except acute aflatoxin is a risk factor, then hemochromatosis is a risk factor, alpha-1 antitrypsin deficiency is a risk factor. Acute hepatitis B is not a risk factor. Chronic hepatitis B is a risk factor. So the option is option B. Next question. Correct statement regarding Graves' disease. More common in male. This option is wrong. It is more common in female. Less commonly associated with TSH receptor autoantibodies. This is also false. Etiology has no genetic component. This is also false. Radioactive iodine uptake studies characterized by normal or increased uptake. This option is correct. So the correct statement regarding Graves' disease is option D. Next question. Janus kinase 2 mutation is not commonly associated with. It is commonly associated with polycythemia, myelofibrosis and essential thrombocytosis. It is not associated with chronic myeloid leukemia. Next question. All statements given below are true with von Willebrand disease except we know that this von Willebrand factor that is associated that always needs this factor 8. So this factor 8 is in intrinsic pathway. When intrinsic pathway, if there is any defect in intrinsic pathway, APTT will be prolonged. If there is any problem in extrinsic pathway, prothrombin time will be prolonged. As here, von Willebrand disease, factor 8 is deficient, so APTT will be prolonged. And as this is a platelet disorder, bleeding time will be prolonged. And factor 8 will be decreased. So the statement which is not true is option A. Next question. Hypertension associated with hypokalemia is seen in. It is seen in Conn syndrome. In Conn syndrome, there is hypertension, hypokalemia, and there is metabolic alkalosis. Next question. In rheumatic mitral stenosis, loud first heart sound indicates. It is pliable mitral valve. Option A. A 20-year-old male presented with low-grade fever, evening rise of temperature, dry cough, and left shoulder pain of 3 weeks duration. Later, his pain subsided and he developed exertional dyspnea and fullness left side. Likely clinical diagnosis from history is. Here, the answer is left-sided pleural effusion. Next, semic oncogene expression is most commonly associated with. It is most commonly associated with Burkitt lymphoma. Next, all are true in Kawasaki disease except one of the common vasculitis in childhood. Correct. Lead to coronary artery aneurysm. Correct. This is option D. Approximately 75% of cases occur under 5 years of age. Correct. And the option which is not correct is option C. That is less common in Asian children. Next, most common site of hypertensive intracerebral bleed is putamen. Next, all are features of multiple myeloma except. Features of multiple myeloma is osteoporosis, renal insufficiency, anemia. It is not hypocalcemia, it is hypercalcemia. So the correct option is hypocalcemia. All are true regarding varicella vaccine except. Vaccination should be avoided in pregnancy. Correct. Pregnancy should be avoided for 3 months after vaccination. Correct. Can be given along with MMR vaccine. Correct. Efficacy of one dose vaccination is only 40%. False. 65-year-old male started on anti-tubercular drugs for pulmonary tuberculosis 1 month back. He presented with severe knee joint pain. His uric acid level is 11 mg. Which statement is more correct? Pyrazinamide can cause high uric acid, correct. Ethambutol can cause high uric acid, correct. Rifampicin can cause high uric acid, false. So option D, A and B are correct. Next, antifungal drug that is used for treating mucormycosis is amphotericin B. All are causes of tachycardia except anxiety cause tachycardia, salbutamol cause tachycardia, thyrotoxic cause tachycardia, obstructive jaundice do not cause tachycardia. Next, clinical findings in systemic hypertension is it causes left ventricular hypertrophy and loud A2. Option D is the correct option. Next, cause of neck stiffness is hyponatremia and meningitis. Option D is the correct option. Beta HCG is maximum at 10 weeks. Lambda sign is seen in DCDA twins. Which of the following is the component of modified biophysical profile? Okay, NST and amniotic fluid index is a component of modified biophysical profile. Artificial rupture of membrane is contraindicated in. It can be done in postnatal pregnancy. It can gestational hypertension, diabetes. It cannot be done in intrauterine fetal demise. Next question. A 28-year-old primary gravida at 37 weeks of gestation was presented to the emergency department with generalized tonic-clonic seizures. No details of ANC was available. The patient was adequately managed and she delivered a 2.8 kg healthy male baby. After 4 hours of delivery, she noticed to have low urine output and on further evaluation was noted to be drowsy with respiratory rate of 7 and loss of patellar reflex. Which of the following most likely caused the patient's condition? This is MGSO for toxicity. Okay. So there will be loss of patellar reflexes. Next, which of the following is not seen in pregnant female? There is increase in plasma volume, there is increase in cardiac output, there is decrease in vascular resistance, there is decreased heart rate. This is false. There is increased heart rate. Cardiac output increase, heart rate increase, stroke volume increase. So answer is option D. Which of the following drug is used for hyperthyroidism in pregnancy? Propylthiouracil. While carbimazole and methimazole, they are contraindicated in the first trimester because it causes aplasia cutis. A 16-year-old female comes to the OPD with complaints of swelling in the vulval area. On examination, there is bilateral swelling in the labia majora and clitoromegaly. The girl has not attained menarche yet. On USG, no uterus or tubes or ovaries could be made out. What is the likely diagnosis? In this question, from this word, this clitoromegaly itself, we can go to the answer, that is androgen insensitivity syndrome. In Mullerian dysgenesis, there is no any bilateral swelling. Okay. Next, a 48-year-old woman presented to you with complaints of severe pain during her menses associated with increased bleeding for the past 1 year. On examination, uterus is bulky and uniformly enlarged, but no focal masses were identified in the USG. The patient underwent a hysterectomy and HPR revealed the presence of endometrial glandular tissue in the myometrium. What is a likely diagnosis? So, from this question, this is a perimenopausal aged woman. Okay, coilocytes are seen. They are seen in HPV infection. Next question. A 65-year-old female lady presented with complaints of fatigue, weight loss and abdominal distension for the past 3 months. It was associated with frequent and urinary urgency and constipation. On pelvic examination, a fixed regular mass was felt in the right adnexa. Which of the following may be elevated in this patient? So this is a ovarian tumor maybe. So in ovarian tumor, CA125 will be elevated. All of the following are true regarding bacterial vaginosis except it's a thin vaginal discharge, fishy odor, pH is greater than 4.5. This Kollexner body is seen in granulosa cell tumor. What is the rate of fertilization in ICSI? 60%. Tumor marker of endodermal sinus tumor is alpha fetoprotein. Endodermal sinus tumor is also called yolk sac tumor. Amylase is raised in all of the following conditions except cystic fibrosis. Indication of surgery in pseudocyst is thick-walled pseudocyst. Regarding ascitic fluid study in the case of abdominal tuberculosis, all of the following statements are true except AFB is seen in 25% cases. Specific gravity is greater than 1.016, correct. Glucose is less than 30 mg, correct. Serum ascitic fluid albumin gradient is greater than 1.1. This is wrong. Next question. As per Rutherford stage of ischemic rest pain, ischemic rest pain is category 4. Next question. Which is the false statement regarding compartment syndrome due to perfusion? Numbness in the web space between first and second toe is due to compression of the deep peroneal nerve. Posterior compartment is most commonly affected. Pressure greater than 20 mmHg is indication for fasciotomy. This is false. Pressure greater than 30 mmHg is indication for fasciotomy. Medial incision relays posterior compartment. Correct. Option C is the correct false statement. Next, thrombosis is seen in. Thrombosis is seen in individuals who sit with computer for long time. Next, conservative management of ETH can be done when maximal clot thickness is less than 1.5 cm. Next question. Which is true statement regarding intracranial hemorrhage? EDH is due to rupture of the middle meningeal artery. Correct. EDH is caused by dural venous sinus tears expand rapidly. False. Chronic conditions SDH greater than 1 cm should be drained. False. Prognosis after evacuation is better for SDH than EDH. False. Next question. A 45-year-old male has brought to the casualty following blunt trauma, chest with respiratory distress and hypertension. Subcutaneous emphysema was present. Trachea was shifted to left air entry. Left air entry was reduced on right side and neck veins were distended. So here the problem is in one side and the trachea shifted to opposite side, and there is respiratory distress and there is subcutaneous emphysema. This is a case of tension pneumothorax. Which of the following statements are true regarding Paget's disease of the breast? In situ carcinoma of the breast. False. Associated with large pale vacuolated cells in the malpighian layer. False. CA immunostaining is positive. False. True. Why local excision is recommended in those without underlying mass? Correct. So option 3 and 4 are the correct answer. Next. Preventive measures and management of Frey's syndrome include all except aluminum chloride, glossopharyngeal neurectomy, botulinum toxin injection. It is acellular dermal matrix interposition is not included. Most accepted theory of evolution of venous ulcer is ambulated venous hypertension. Congenital venal anomalies are found in all except. It is found in Paget-Schroeder disease, Klippel-Trenaunay syndrome, May-Trenan syndrome. It is not found in Budd-Chiari syndrome. Next question. Which is false statement regarding molecular subtypes of carcinoma breast? Basal-like type tumors are triple negative. Correct. Luminal B type is most common. Correct. Luminal A type is ER positive with HER2 negative with good prognosis. Correct. And the false statement is Claudine low. A recently described class is triple negative with low expression of E-cadherin. False. Health adjusted life expectancy is based on life expectancy at birth but include an adjustment of which of the following parameter? It will include time spent in pure health. Listed below are methods of estimating the age standardized rate except estimating the index death rate and standardization factor for each population. Correct. Estimating the specific death rate in the specific age categories. False. Indirect standardization method, multivariate regression analysis. So option B is false. Is not included. Attributable risk of a exposure refers to which of the following option? To what an extent the disease under study can be attributed to an exposure. So this is the correct option. Next. What does the predictive value reflect for a screen test? To diagnose the diagnostic power of the screening test. The more prevalent the disease is, the more accurate the predictive value. The predictive value depends upon the sensitivity, specificity and disease prevalence. This is false. So option A is correct. Next. Which of the following features of rash are suggestive of chickenpox infection? The centripetal, palms and soles are seldom affected. Axilla affected. Rash is mostly on the flexor surface. Option D is the correct answer. Next. Which among this is the most frequently used method when a blinded trial is conducted? Double-blinded trial. For a crossover type of randomized control trial, which is not true? Which of the following is not true? The patient does not serve as his own control. Correct. Patients are randomly assigned to a study and control group. Correct. The study group received the intervention in the first phase. The control group received the intervention in the next phase. So all the options are true. So here none of the above is the answer. All are incorrect for a tuberculin positive skin reaction with an induration size of 5 to 10 mm except when it is seen in when it is seen in a HIV positive person. The global target of tuberculosis elimination refers to all except reach at least 90% of all with TB, reach at least 90% of the key population, at least achieve at least 90% of the treatment success, and achieve at least 90% detection rate. So here option B, only option 4 is not included. Next, the key intervention of global strategy for viral hepatitis are all except diagnosis of hepatitis B and C virus, correct. 2-dose hepatitis B vaccine for infants, wrong. Treatment of hepatitis B and C virus, blood safety and injection safety, both are correct. So option B is the correct. For as per ZAREP regimen, which of the following is the dosage schedule for post-exposure prophylaxis for rabies prevention? We are giving a 4-dose multi-site regimen with 2 doses to be given on day 0 and 1 dose on day 7 and 21. So option D is the correct answer. All are hormonal contraceptive except or CP is oral hormonal, is emergency contraception pill is hormonal, depot medroxyprogesterone acetate is hormonal, Sencromon is not, it is SCR. Okay, who definition of perinatal mortality rate in nation with less well-established vital records is which of the following? So, this perinatal mortality rate means late fetal death, that is from 28 week of gestation and more, plus early neonatal death. Early neonatal death means early first week of life in 1 year. This is divided by total live birth in the same year into 1000. So, this is the correct answer. Disaster cycle include. So, disaster cycle include response, preparedness, mitigation. There is no disaster elimination. Okay. Next. A 5-year-old boy brought with complaints of growth of pubic hair. On examination, child told for his age with deepening of voids. Apart from the presence of pubic hair, there was increase in the testicular size both side and increased penile length. Which among the following is not likely in this section? Can be hypothalamic hamartoma, pituitary adenoma. It cannot be this adrenocortical tumor. So option C. A 6-year-old term neonate presented with jaundice. The bilirubin was total 14 mg per dl with direct fraction 6 mg per dl. Blood group of baby A positive, mother O positive. Which among the following make this as a case of pathological jaundice? So here increased conjugated bilirubin value. So this make it as a case of pathological jaundice. 3-month-old infant presented with history of cough and nasal discharge for 5 days and first episode of breathlessness for past 2 days. On examination, active and playful child, respiratory rate 55 per minute, chest hyperinflated, breath sound equal with bilateral expiratory wheeze and crackles, liver palpable 4 cm below and costal margin, span 5 cm. What is the most common etiological agent? So from this we can understand a child with 3 months. So here the most common viral infection is affected is bronchiolitis. So and also here it is given that liver is palpable below 4 cm below the costal margin. From this all we can understand this is a case of bronchiolitis. This bronchiolitis is caused by the respiratory syncytial virus. Next, during the initial steps of resuscitation of a neonate with birth asphyxia, when there is a failure of the expansion of the chest with bag and mask ventilation, what is the corrective step to be tried? So the corrective step to be tried is to suction the mouth and nose. Next, which among the following condition is not associated with short stature? Turner syndrome, short stature. Silver Russell syndrome, Cushing syndrome is also short stature. This is not any short stature. So option D. A 3-month-old baby born of second degree consanguineous marriage was brought with complaint of feeding difficulty and poor weight gain. On examination, thin and floppy infant with large protruding tongue, tachycardia and tachypnea plus cardiomegaly, ejection systolic murmur at upper left sternal border, hepatomegaly. Which among the following is most likely to cause? So the options are infantile palm disease, von Jett disease, phenylketonuria, mucopolysaccharidosis. So from this we can understand that the case with this associated with cardiomegaly and which is associated with heart is infantile palm disease. Okay, so option A is the correct option. 1-month-old baby with complaints of non-bilious vomiting since second week of life. On examination, thin, emaciated and dehydrated. Abdomen distended with visible peristalsis in the upper abdomen. USG abdomen clinched the diagnosis. So what is the most appropriate step next to be taken? So This may be a case of congenital hypertrophic pyloric stenosis. So what we have to do first we have to correct the rehydration and correct this electrolyemia. Then only we have to refer to surgeon. Okay, so option D is the correct answer. Which among the following is a criteria for severe acute malnutrition? For severe acute malnutrition, we know that there is height for weight for height, that is less than -3 standard deviation. Mid upper arm circumference is less than 11.5 centimeter. Okay, and there is bilateral pedal edema. Okay, so here the answer is C. I think it is weight for height. A 3-year-old girl was diagnosed to have oligoarticular rheumatoid arthritis. She was found to be ANA positive. Which organ is to be urgently evaluated and frequently followed up to avoid complications? So the organ which have to be urgently evaluated is eye, not heart. Okay, it is eye. Option A. 72. 1.5-year-old child with fever and skin rash for past 6 days. On examination, child is irritable. It is bilateral conjunctival congestion, cheilitis with oral mucosal congestion, left posterior cervical lymph node enlarged slightly, tender generalized maculopapular rash present, no hepatosplenomegaly. Initial investigation revealed marked increase in acute phase reactants. What is the most important investigation you will order next? This is a case of Kawasaki disease. So 1.5-year-old, we know that Kawasaki disease 5-day fever with creep, that is conjunctivitis, non-purulent conjunctivitis, rash, that is edema, there is lymphadenopathy, and maculopapular rash. So we have to urgently do echo to look for coronary artery aneurysm. Which among the following is the most common congenital heart disease seen in children with Down syndrome? This is a simple question. The answer is endocardial cushion defect. A newborn was born with complaints of not passing meconium within 24 hours. Which among the following condition could lead to delayed passage of meconium? So prematurity can cause, hypothyroidism can cause, Hirschsprung disease can cause. So all the options are correct. 75. A recently married woman was found hanged in her bedroom. Which of the following statement in this regard is correct? A magistrate should hold the inquest. Correct. A police inspector can hold the inquest if so delegated by the magistrate and can send the body for postmortem. This is not wrong. Or the autopsy should be conducted by a team of doctors and should be videographed. Correct. So here option 1 and 3 is correct. Option C is the correct answer. A person sustained head injury in fall from a tree by his left side of the head, the parietal eminence hitting the ground. Pick up the correct choice of response that substantiate above history. Contusion of the right parieto-temporal lobe of the brain with subdural hematoma. This is correct. Contusion of the left parietal lobe of the brain with subdural hematoma. False. Fracture of the skull at the left parietal bone. False. So option A is the correct answer. A dead body was seen in pugilistic attitude with surface burn. Which of the following are crucial in arriving at burns as the cause of death here? So heat changes of the hairs. This is not that crucial. Assessment of vital changes in spectroscopic examination. These are the correct. The following conditions except have clinical manifestations similar to acute alcoholic intoxication. This diabetic ketosis, cerebrovascular accident, and hypoglycemic coma. These three of them, they have similar as that of alcoholic intoxication. Hepatic encephalopathy do not have. Few bones of a human being were recovered from a hidden place. The sex was identified from the characteristic features, those given just below. 1. Skull, the upper edge of the orbit was sharp. Sternum, the manubrium sternum was longer than the half the length of the mesosternum. Femur, the colodiaphyseal angle was less obtuse. Which one of the following traits does correspond to the biological sex identified from the above features? Here, the upper edge of the orbit is sharp. This means that we know that males has a round blunt margin. So this skull is of female. Sternum, manubrium sternum is longer than half the mesosternum. This is seen in female. It means manubrium sternum is less than half of the mesosternum. Third is femur colodiaphyseal angle is less obtuse. We know that males have more vertical femur, that means less obtuse angles. Female more obtuse angle. But these all features suggest male, but skull plus sternum strongly point to female. So as we know that the skull is most reliable, we can take this overall sex as a female. Coming to the question, which one of the following traits does not correspond to the biological sex? So they are asking which is not corresponding to the female. So here the question is, which of the following thrusts correspond to the female? Here distinct frontonasal angulation is seen in, that is in male. Wide and shallow greater sciatic notch is in female. Pubic bone triangular at body is in male, and mean corporobasal index 45, that is around 45, is male mandible. So here the trait that correspond to the biological sex is B. This is somewhat tough question. It will take some time. Next question. Which of the following statement regarding consent is correct? Consent should be taken from the husband before terminating the pregnancy under MTP Act of 1971. This is wrong option. Detailed description of the nature and effect of the treatment may cause it less likely to secure consent from the patient and hence should be avoided. This is also false. Broad-based general consent protects a surgeon who should want to conduct extensive surgical procedure other than the one to which it is agreed from any future litigation. Correct. So the option C is the correct answer, and oral consent is not as good as written consent. False. Next. A 40-year-old man presented with backache. X-ray showed destruction of T12 and L1 vertebrae and shows intervertebral space narrowing. The most common diagnosis in a patient with backache and there is intervertebral disc space narrowing is tuberculosis of the spine. So option B. Next. A 10-year-old boy has flexion deformity of the right elbow, angulation and shortening of ulna, restriction of extension, supination and pronation. He had injury 3 weeks back at school. How will you manage this clinical condition? So this is a case of Monteggia injury with malunited, shortened, angulated ulna causing a persistent radial head dislocation. Okay. So here we can do a corrective ulnar osteotomy to restore the length or alignment and reduce the radial head. So radial head excision is contraindicated in a child. So the answer is osteotomy of the ulna with radial head repositioning. Next. A 74-year-old lady comes with inability to walk. She has severe osteoarthritis of the knee. The surgeon explained about total knee arthroplasty and the risk of foot drop. The deformity most often associated with foot drop is valgus and flexion contracture. In the correction of clubfoot, manipulative casting technique is nowadays commonly used. In the process of correction, which statement is true? Option A. To begin with, pronation twist is corrected. This is correct. Below knee casters are applied every 5 to 7 days. This is wrong. Go begin, the echinus is corrected. This is false. We are always starting as cave. First cavus, then adductus, then varus, then echinus. This is wrong. Percutaneous Achilles stenotomy is done before the third cast. This is also false. A 63-year-old gentleman present to the ENT OPD with right-sided earache of 2-week duration, which has been progressive and is severe during night hours. He has been a diabetic for more than 20 years. Examination of the ear showed a small granulation on the floor of the external auditory canal with minimum discharge in the canal. The tympanic membrane were grossly normal. Hearing was normal by tunic fog. Which drug would you start for this patient empirically? So this is a case of malignant otitis externa. So for malignant otitis externa is most commonly caused by pseudomonas. For this we are giving anti-pseudomonals. We can give ciprofloxacin. Next question. A 45-year-old lady is brought to the casualty with severe vertigo and vomiting of 1 day duration. She has a history of left ear discharge of 10-year duration. Examination of ear showed a perforation in the pars flaccida with yellowish debris. The fistula test was positive on the left side with nystagmus beating to the left side. What would be her preferred position to lie down in bed? So coming to the question, she has a long-standing left ear discharge and there is a pars flaccida perforation plus debris. So this suggests that this is a active cholesteatoma. Positive fistula test is on the left side. Nystagmus is beating to the left and the labyrinthine irritation on the left. Patient with labyrinthine fistula or vertigo prefer to lie with the affected ear down because it stabilizes the perilymph and it will reduce the movement of the stapes over the fistula, and this way it will reduce vertigo. So the patient will prefer to lie with her left ear down. Next question. A 50-year-old gentleman was brought to the ENT OPD with severe pain on the right side of the face and dimness of vision. He was a diabetic for the past 20 years. Examination showed conjunctival chemosis and mild proptosis of the right side. The nasal cavity showed black scar on the lateral wall with purulent discharge. Her random blood sugar level was 415 milligram percentage and HbA1c 10.3. What is the drug of the choice for this condition? From this we can understand there is nasal cavity, there is a black scar, and this is a diabetic patient. So this is a case of mucormycosis. For mucormycosis, the drug of choice is liposomal amphotericin B. Next, during total thyroidectomy for papillary carcinoma thyroid in a 36-year-old lady, the recurrent laryngeal nerve of the right side was sacrificed for oncological safety. The next day, the patient complained of breathy voice. A fiber optic laryngoscopy on the second postoperative day showed vocal paralysis of the right side. What would be the position of the right and left vocal cord in this patient on phonation? So for this question, the key point is right recurrent laryngeal nerve was sacrificed. That is right vocal cord paralysis. So what is the position of a paralyzed vocal cord? When a recurrent laryngeal nerve is cut, the vocal cord assumes a paramedian position. That is not fully abducted and not fully adducted. Okay. Thus right vocal cord is paralyzed and that is in a paramedian position. What about the left vocal cord? Left vocal cord is normal. On phonation, normal vocal cord will move to the median position. So here vocal cord median position, left vocal cord is in median position. So here the correct answer is right is in the paramedian and left is in the median. So here answer is option C. Next, all are causes for secondary angle closure glaucoma except phacomorphic glaucoma. This is correct. Subluxated lens cause glaucoma. Then chronic anterior uveitis cause secondary angle closure glaucoma. This pseudo-exfoliation glaucoma that will not cause secondary angle closure glaucoma. Next, characteristic feature on slit lamp examination in a case of granulomatous uveitis, that is mutton fat keratic precipitates. Cherry red spot at the macula is seen in central retinal artery occlusion. Next, hallmark of proliferated diabetic retinopathy is neovascularization. Which among the following is toxin-mediated streptococcal disease? This is not toxin-mediated. Here, this impetigo-contagiosa is the toxin-mediated streptococcal disease. Munro microabscess that is seen in the stratum corneum of the psoriasis. Okay. Which clinical type of leprosy occurs with leonine facies? It will occur with lepromatous leprosy. Necrolytic migratory erythema is associated with glucagonoma. Next, which of the following is the current law in relation to the mentally ill patient in India? This is Mental Health Care Act. The following are motor disorders symptom except mannerism, waxy flexibility, stereotypic movement. This illusion is not a motor disorder. The following is a feature of depressive disorder. Okay, here anhedonia is the only one which is a feature of depressive disorders. Next, the following is correctly matched. William Cullen psychosis, false. Emil Kaplan 4As, no, it is dementia precox. Eugen Bleuer schizophrenia, correct. Kurt Schneider is first rank symptom. I have already discussed this in my YouTube video. അപ്പോൾ ഇതായിരുന്നു 2023 ക്വസ്റ്റ്യൻ പേപ്പർ. അപ്പം 2000 റാങ്ക് ലിസ്റ്റ് നോക്കിയ സമയത്ത് അപ്പം മെയിൻ റാങ്ക് ലിസ്റ്റിൽ ഫസ്റ്റ് റാങ്കിന് അറൗണ്ട് 70 മാർക്ക് അങ്ങനെ ആയിരുന്നു ഉണ്ടായിരുന്നത്. പിന്നെ ഈ മെയിൻ ലിസ്റ്റിൽ വന്നത് 47 മാർക്കുള്ളവരാണ് ലാസ്റ്റ് മെയിൻ ലിസ്റ്റിൽ വന്നിരുന്നത്. ഇപ്രാവശ്യം എന്താണേലും ആ ഒരു ലെവലായിരിക്കില്ല, എന്താണേലും കൂടും. സോ എല്ലാവരും നല്ലോണം പഠിക്കുക. സോ നെക്സ്റ്റ് ഡേയ്സ് നമുക്ക് വേറെ ക്വസ്റ്റ്യൻ പേപ്പറും ചെയ്യാം. ഓക്കെ, ബൈ.